Chapter 6, Oxygen Transport, from Desjardins' Cardiopulmonary Anatomy and Physiology. Today we're going to talk about how oxygen is transported from the lungs to the tissue, and later we'll talk about the oxy-dissociation curve and its clinical significance in another short video. To fully comprehend this subject, you'll also need to know how various transport calculations are used, major forms of tissue hypoxia, and carbon dioxide, how that's transported from the tissues to the lungs, all of which we'll talk about in other short videos. This is a radial arterial blood gas stick. Notice that it's on the thumb side of the arm. Normal blood gas values. As you can see, in the arterial blood, the pH range is 735 to 745. The PCO2 is 35 to 45. The bicarb is 22 to 28. And PO2 is 80 to 100 torr. The venous side is a little more acidic. A normal range is 7.30 to 7.40. CO2 is a little bit higher, 42 to 48. Bicarb remains relatively unchanged, but again is a little higher, 24 to 30. And PO2 is significantly lower, 35 to 45 torr. You'll need to memorize those values. Let's go on to talk about how oxygen is transported in the blood. Some basics of oxygen transport. The transport of oxygen between the lungs and the cells of the body is a function of the blood and heart. Oxygen is carried in blood in two forms. Dissolved oxygen in blood plasma, and that's only a tiny bit, and chemically bound to hemoglobin that's encased in the erythrocytes or RBCs. First, let's talk about oxygen dissolved in the blood plasma. Dissolved means that the gas maintains its precise molecular structure, in this case O2. The quantity of oxygen that is dissolved in plasma is a function of Henry's law. Henry's law states the amount of gas that dissolves in a liquid at a given temperature is proportional to the partial pressure of the gas, or in this case, plasma. About 0.003 milliliters, a very tiny amount of oxygen, will dissolve in every 100 milliliters of blood for every 1 torr of PO2. Thus, the PaO2 of 100 is equal to 0.3 milliliters. 100 times 0.003 is equal to 0.3 milliliters. We write this as 0.3 vols percent, VOL, percentage sign. Vols percent represents the amount of oxygen in milliliters in 100 milliliters of blood. Here's a quick question for you to think about. What does vols percent represent? Can you remember what we just talked about? Quickly write it down. Vols percent represents the amount of oxygen in milliliters in 100 milliliters of blood. Normal vols percent of plasma is about 0.3. If that's what you wrote down, great job. For example, 10 vols percent of O2 means that there are 10 milliliters of oxygen in 100 mils of blood. Relatively small percentages of oxygen is transported in the form of dissolved oxygen. Most oxygen that diffuses into pulmonary capillary blood rapidly moves onto the RBCs and chemically attaches to the hemoglobin. Just so you know, each RBC contains about 280 million hemoglobin molecules. It's packed. Oxygen bound to hemoglobin. Normal adult hemoglobin, or HbA, consists of 4 heme groups. These are pigmented iron-containing non-protein portions of the hemoglobin molecule. There are also 4 amino acid chains, or polypeptide chains, that collectively constitute the globin portion, or protein portion of the molecule. Pictured here. Hemoglobin carries oxygen throughout the body on the red blood cell. Let's look at a schematic illustration of the hemoglobin molecule. The globin or protein portion consists of 2 alpha chains and 2 beta chains. The 4 heme or iron-containing portions are in the center of each globin molecule. Because there are 4 heme or iron groups in each hemoglobin molecule, a total of 4 oxygen molecules can combine with each hemoglobin molecule. When 4 oxygen molecules are bound to 1 hemoglobin molecule, the hemoglobin is saturated, and so forth. Hemoglobin bound with oxygen, or HbO2, is called oxyhemoglobin. Hemoglobin not bound to oxygen is called reduced hemoglobin or deoxyhemoglobin, or simply hemoglobin. The amount of oxygen bound to hemoglobin is directly related to the partial pressure of oxygen. So, oxyhemoglobin is hemoglobin bound with oxygen. Reduced hemoglobin is hemoglobin not bound to oxygen. It's also known as deoxyhemoglobin or just hemoglobin. Here's a question for you. What is reduced hemoglobin called? I'm going to let you think about it. Write it down. Are you ready for the answer? It's also known as deoxyhemoglobin, hemoglobin, and it's hemoglobin not bound with oxygen. Pictured here, oxy and deoxyhemoglobin. Oxygen bound to hemoglobin in a normal adult male is usually 14 to 16 grams percent. Notice that the adult female hemoglobin value is lower, 12 to 15 grams percent. That's due to menstruation. Clinically, weight measurement of hemoglobin in reference to 100 ml of blood is referred to as either gram percent hemoglobin or grams per deciliter. Pictured here are normal hemoglobin levels by age group. Each gram percent hemoglobin can carry 1.34 mils of oxygen. So, if hemoglobin level is 15 grams percent, and if hemoglobin is fully saturated, about 20.1 vols percent of oxygen will be bound to the hemoglobin. And here's what it looks like in a mathematical formula. 1.34 mils of oxygen times 15 grams percent hemoglobin is equal to 20.1 vols percent. This represents the oxygen bound to hemoglobin and is how you can calculate oxygen bound to hemoglobin. At a normal PaO2 of 100 torr, oxygen saturation, or SaO2, is only approximately 97%. This is due to the following three normal physiologic shunts: the thespian venous drainage into the left atrium, bronchial venous drainage into the pulmonary veins, and alveoli that are underventilated, or dead space. So the amount of arterial oxygen in the preceding equation must be adjusted from 100% to 97%. So 20.1 vols percent times 0.97 is equal to 19.1 vols percent of oxygen bound to hemoglobin. So how do we determine the total oxygen content? Well, that's the factor of two things: oxygen dissolved in the plasma and oxygen bound to hemoglobin. To determine the total amount of oxygen in 100 milliliters of blood, you've got to add the two together. Let's look at a case study that summarizes calculations required. Let's look at this in the perspective of a case study. This one will include an anemic patient. So we have a 27-year-old woman with a long history of anemia, which means her hemoglobin concentration is diminished. She shows signs of respiratory distress, including a respiratory rate of 36, tachycardia of 130 beats per minute, and a high blood pressure, 155/90. These kinds of vital signs are typical in an anemic patient trying to compensate for her lack of hemoglobin. Hemoglobin concentration for this patient is 6 grams percent. Your P(a)O2 is 80 torr, and oxygen saturation is 90%. Use the calculation below to calculate total oxygen content. So, oxygen bound to hemoglobin will be 6 grams percent times 1.34, the O2 bound to hemoglobin factor, times 0.90, SaO2. If you got 7.236 vols per cent, you're correct for the amount bound to the hemoglobin, but that's only half the equation. We need to look at the portion in the plasma. Yes, it's small, but important. Based on the information, the patient's oxygen content dissolved in the blood, not bound to the hemoglobin, is calculated as follows. The PaO2, 80 millimeters of mercury times 0.003 is equal to 0.24 vols per cent. Now let's put it together. Total oxygen content is equal to 7.236 vols per cent, that bound to hemoglobin, plus 0.24 vols per cent dissolved oxygen, equal to 7.476 vols per cent, or the total amount of oxygen in 100 milliliters of blood, using the formula pictured here. Notice that the patient's total arterial oxygen content is less than 50% of normal. The patient's hemoglobin concentration is extremely low, and that's the primary mechanism for transporting oxygen. Once the problem is corrected, respiratory distress should no longer be present. This patient needs blood. There are several types of total oxygen content equations. Oxygen content of arterial blood, or CaO2, oxygen content of mixed venous blood, CvO2, and oxygen pulmonary capillary blood, or CcO2. We're going to look at the differences in each equation. So, CaO2, or oxygen content of arterial blood, is just what we calculated with our anemic patient. Hemoglobin times the 1.34 times oxygen saturation plus PaO2 times 0.003%. That bound to hemoglobin and that dissolved in blood. Let's look at mixed venous values. To calculate the content of mixed venous blood, we still use hemoglobin, we still use the same factor, but we're going to use the saturation of the mixed venous blood. So hemoglobin times 1.34 times SvO2 plus the PvO2 instead of the PaO2 times 0.003, the same factor. An oxygen content of pulmonary capillary blood is just a little different because it's what's in the lungs. Capillaries are directly exposed to the oxygen content in the lungs. So we have hemoglobin times 1.34 plus PbAO2 times 0.003. You'll have to use, in some cases, the equation for PbAO2. So, join me later to learn more about how various mathematical manipulations of CaO2, CvO2, and CcO2 values are used in different oxygen transport studies, and to reflect on important factors concerning a patient's cardiac and ventilatory status. Coming up soon, transport oxygen transport calculations. This is the end. Thank you for your time and attention.